Welcome to the University of Cincinnati. My name is Michael Thomas. I'm the chair of the department, was formerly the division director for 19 years of reproductive endocrinology and infertility. It's important that we allow you to look at all aspects of the Department of Obstetrics and Gynecology. At the University of Cincinnati, we have all of the subspecialty services represented, as well as a very strong division of general obstetrics and gynecology. The reproductive endocrine division has been around for a long period of time, actually since the early 1980s. I came here as the first fellow in 1988 and have been here ever since. Joined the faculty in 1990 and then became the division and fellowship director in 2001. We continue to have a very strong and robust reproductive endocrine division with a number of opportunities for our residents and fellows when it comes to not only the IVF program, but also the surgery, particularly the hysteroscopic and laparoscopic surgery. I think that you will be very surprised to see that our program, where other reproductive endocrine programs are sort of shying away from surgery, our reproductive endocrine program has really led in head first and continues to be on the forefront of surgical procedures, particularly more minimally invasive type surgical procedures. The maternal fetal medicine program has been around for a long period of time as well. We have a very wide-ranging group of faculty in the Division of Maternal Fetal Medicine, including the fellows that we get from all over the country. I'm very strongly supportive of that division, and I think they're one of the backbones of what we do and why we are so successful in our region. One of the things that I, as the chair, want to continue to do is to make sure that our resident as well as fellow experience continues to be as robust as possible in maternal fetal medicine so that you can get the best experience possible in managing our high-risk obstetrical patients. The Division of Gynecologic Oncology is a division that has been around since I got here in 1988. We've had one or two faculty. Now we have three great faculty here downtown at the University of Cincinnati UCMC program in Westchester. Then we have three more great faculty at our Kettering and Miami Valley locations. The goal pretty soon is to get a fellowship program in gynecologic oncology, and we're working very hard to do that. I think that will even make our program more robust, but at the time, that gives all of our residents a great opportunity to get good hands-on surgical experience in gynecologic oncology. The Division of Urogynecology, or the FPMRS division, is one of our great divisions within our department, and residents have gotten a lot of hands-on experience. We work in conjunction with the fellowship at Christ Hospital and in the process of putting together a pelvic floor disorders program with the Department of Urology, which is within the Department of Surgery.
My name is Michael Bolt. I'm the Residency Program Director at the University of Cincinnati Medical Center. I went to medical school here at the University of Cincinnati and did my residency training here as well, so I'm a Bearcat through and through. Some of the things that stand out about the University of Cincinnati program are the number of professionals that we get to work with. So we have faculty who are trained in all of the subspecialties, including MFM, REI, urogynecology, family planning, and we even have the unique opportunity to work with people who are trained in peds and adolescent gynecology through Cincinnati Children's Hospital Medical Center as well. So here, residents will receive the training that they need to go on and be generalist practitioners if they choose, and also be able to go out into the various subspecialties as well. One of the other advantages that University of Cincinnati has is our affiliation with the Christ Hospital, which is a local community-based hospital. We have the opportunity to work with multiple gynecologic specialists who do GYN surgery, including traditional straight stick, and robotic surgery, open surgery. So our residents will get the surgical skills that are necessary to go out into either private practice, academic practice, or, as I mentioned, the subspecialties too. Our residents have the opportunity to work in a number of different clinics here at UC and our neighboring institutions. Each week they have about a half day where they will see their continuity clinic patients with us at the Hawksworth Center for Women's Health. We also have a private office north of here in Midtown, which residents will have the option to go to. We also have a number of community-based practice sites, so they have the advantage to work in the public health centers. We also work with the subspecialists in clinic, including our Urogyne clinic. We also have dedicated MFM clinics, including fetal care, which specializes in taking care of babies who have birth defects or different complications in pregnancy. We also have our maternal complications in pregnancy clinic, or our MCPC clinic, our diabetes clinic, our Gynecology clinic, our dysplasia clinic, so residents have a lot of opportunities to see and do various things. At UC, our graduates go on to any number of different things. Many go into private practice as generalist specialists. Some will also go into academic medicine as well. We've had residents go all over the country. We've even had some graduates go and practice global health in Africa. We also have residents who match into various subspecialties. So we've had 2 who've matched into urogynecology this year. We have 2 interviewing for REI and 1 interviewing for oncology, and 1 interviewing for MFM as well. Our faculty at UC are dedicated to the tripartite mission for academic medicine, so we focus on research, which residents will get to work one-on-one often with a faculty doing their research project that's required for their residency graduation. We also work on education, whether it be medical student or resident education. And as most and all training programs have, we also focus on patient care, so that encompasses our inpatient and outpatient services. Our residents will do a research project over the course of their training. We ask that they create their own project. They do get assistance with faculty and co-residents and can have help with developing their project from any aspect. They have the option to work with subspecialists and specialists in OBGYN. Most residents will present in their 3rd year, and then that gives them the opportunity to publish their work in their 4th year and apply for conference presentations at the local and national levels. At UC, we do have electives available throughout the training. Some of those include the option to do a peds and adolescent gynecology rotation in your 2nd or 3rd year. You also have an elective month in your 3rd year to do any number of things that the resident would feel necessary. So we've had in the past residents who have done ultrasound elective. We've had some do GYN surgery electives with our partners at Westchester Hospital. So people have been very creative, and we encourage that so that residents get what they need. One thing that Cincinnati is unique is that in Hamilton County we have higher rates of infant mortality. So in the past years, the University of Cincinnati, we have worked with our local nonprofit organization, which was co-founded by one of our generalist faculty, Dr. Elizabeth Kelly. We've worked with the Cradle Cincinnati team to help improve and decrease infant mortality here in Hamilton County and Cincinnati.
My name's Elizabeth Kelly. I'm the Executive Vice Chair in the Department of Obstetrics and Gynecology, and I am also the Section Director for the Section of Community Women's Health. I've been on the faculty here for 26 years and committed my professional career to caring for women who live in poverty in community-based health centers, primarily to address the social determinants of health that contribute to adverse outcomes for women, maternal care, and infant care. My career has taken some different pathways during that time, and one of them most recently, 7 years ago, was to focus on infant mortality. And people would say, well, you're an obstetrician gynecologist, why are you focusing on the lives of infants? Well, the thing about it is that the primary driver of infant death is preterm birth. And preterm birth is exclusively a maternal health issue. And women of color, primarily Black women, and women who live in poverty suffer the burden of infant death. So it really fell right into my sweet spot of what I really care about and how I've committed my life in women's health. I'd like to talk a little bit more about what Cradle Cincinnati is. So it's a collective impact collaborative. which is based in Hamilton County to address infant mortality in Hamilton County. And to really start looking in the prenatal care space, I formed a learning collaborative called Cradle Cincinnati Learning Collaborative. So it's a branch off of Cradle Cincinnati, but housed under Cradle Cincinnati. And it does involve the University of Cincinnati Medical Center, and we use the IHI breakthrough model, which involves very specific quality improvement metrics. I enjoy education, I embrace education. Our residents and our fellows and our medical students are the future of medicine. So being able to interact with residents and medical students and fellows, not only around the technical aspects of surgery and deliveries and how to manage certain conditions, but also in helping to impart knowledge around social determinants of health and what community-based medicine means. The cornerstone of education, of course, is educating learners in every kind of situation, and we are really privileged to be able to work specifically with residents. And during their 4-year tenure with us here, we have the privilege to interact with them in many different venues. We take pride in the fact that we graduate residents that go on to fellowship that are interested in academic medicine, but also interested in community medicine, or what we would say traditional practice of obstetrics and gynecology. We have an outstanding faculty here. There are people that have very diverse interests, and the diversity of those interests make us a whole. And that whole is what allows us to impart knowledge and have a relationship with residents to help groom them into fellowship or whatever direction they want to go in, and really to help them build a foundation from which they can practice whatever kind of practice they think they want to.
My name is Meredith Pensack. I am a generalist in the Department of Obstetrics and Gynecology at the University of Cincinnati. About a year ago, we officially became a Ryan Residency Training Program in Family Planning. What that is a national program throughout the United States that supports training for obstetrics and gynecology residents in family planning. So this includes pregnancy options counseling, abortion care, contraception, and all the things that fall into our subspecialty of complex family planning. So what that means here is that the residents as an intern rotate for 6 weeks on this rotation. They split their time between our local Planned Parenthood here in Cincinnati, our complex contraception clinic at Hawksworth with myself, and in our health department clinics with our other faculty member, Dr. Mary Ann DiNapoli. This is a really strong program that we have in our division that includes the section of community women's health, where we staff all of the health department clinics here in Cincinnati, providing obstetrics and gynecology care to our patients and community members. And then they need services such as having their babies, having their GYN surgery, they come and deliver and have their care with us here at UC. And so as part of the family planning rotation, our residents spend time in the community clinics with Dr. DiNapoli doing all sorts of contraception care, IUDs, Nexplanons, and they do some general gynecology and obstetrics while they're there as well. The other part, while they're at Planned Parenthood, we provide full spectrum abortion care there for all of our patients in Cincinnati. Due to legal restrictions here in Ohio, most of our pregnancy termination care is done at our Planned Parenthood, and our residents are fully integrated into care there. We are a partial participation program, meaning that all of our residents are required to participate in the rotation, but at a point where they're comfortable. We want to make sure that all of our residents feel safe and comfortable in the care that they're providing, while still learning what they need to learn to meet the requirements of the ACGME. So we do this by having a values clarification workshop as they start off their intern year, so they really start exploring their feelings around complex family planning and obstetrical issues. And then the residents work one-on-one with me, with the other faculty members, Dr. DiNapoli, our other family planning faculty member, Dr. Priya Gursahani, to really find the balance in the rotation to provide that care and get the learning that they need while also feeling comfortable. What this does is it provides that protected time for our residents to have that training. It's not only the clinical training, but it's the education around family planning, and it's also an opportunity to start exploring research topics around family planning. So we have a really robust family planning research projects at UC. We are part of the NIH Contraceptive Clinical Trials Network here and have been under the leadership of Dr. Thomas for about 20 years. So since that initiative started by the NIH. And what that means is that we enroll women in all kinds of contraceptive studies, so new IUDs, new birth control pills, new emergency contraception, and then we participate in the data analysis, manuscript writing, and eventually getting these products to market. So it's a really exciting opportunity for those people who might have interest in clinical research trials and family planning to really find a place for that. We also have other research opportunities with our colleagues across the state looking at issues that face family planning as far as legislative issues, access to care. We work closely with sociologists at the university main campus, economists, on a larger initiative of research projects to really help that. So not only are we providing the clinical care of family planning and the education, but we're also really actively involved in research. At the end of the day, what we want to say here at UC is that we are not just the city, but really the region's only academic medical center and the leader in women's health, and the only place that really has comprehensive reproductive health care for our patients, for our residents. You're just not going to find these other issues at other hospitals here in this region. As far as our family planning goes, as far as our community building for our other areas of gynecology we take care of women with disabilities, with different abilities, our trans patients, our patients with complex medical problems that get turned away from other hospitals. And here at UC, not only do we take care of them, we want to take care of them.
Thank you for watching our video about our residency program here at the University of Cincinnati College of Medicine in the Department of Obstetrics and Gynecology. We'd really like to get some feedback from you, and you can always call me anytime as chair. You can contact me at thomasma@ucmail.uc.edu. We'd like your feedback, and we'd like you to keep in touch with us. If you have any other questions, we're always here for you.